previous video, we discussed what cognitive techniques are, when it is used, and the common distortions faced by the BPD patients. In this video, we will discuss cognitive techniques in detail. The first technique is Socratic dialogue. This technique helps the therapist in understanding which emotions and reactions are justified and which ones are too strong. It involves the use of questions like what, why, who, and which, as it aims to allow the patient to discover that there is more than one possible interpretation of a situation. To carry out this technique, the patient must have sufficiently developed her healthy adult mode. This is necessary for her to be capable of thinking up alternate interpretations. This is one of the reasons that the BPD patients are not capable of using this technique during the first stage of the therapy. The second technique is evaluation on a visual analog scale. This scale is useful when the patient only thinks in black and white about herself and about others. The therapist prepares a scale which has two extremes. For example, too smart or too naive. Then the patient is asked to mark herself and some other people depending on the degree to which she and others are naive or smart. The patient is more likely to mark herself at 0 or near 0, representing the naive. The therapist then asks her again if she has marked herself at the correct place. On the contrary, she discovers that she does not belong on the extreme ends of the scale. The next technique is multidimensional evaluation. This technique is used when the patient uses only one dimension to evaluate her self-worth. For example, I am not worthy because I scored less marks in an exam. In this case, the therapist asks the patient to prepare an inventory of the characteristics that the patient thinks makes a person worthy. The patient usually names the characteristics which she lacks, for example, having no friends, scoring low marks on an exam, etc. Once these characteristics have been listed, then the therapist asks her to rate the people she knows on the different scales, the range being 0 representing the lack of characteristic and 100 representing the presence of characteristic. Once the patient has marked other people on the scale, the therapist asks her to mark herself. This method is usually successful and the patient ends up with a much more positive self-image than she started out with. The next technique is two-dimensional reproduction of supposed connections. This technique deals with two factors that the patient thinks are connected. For example, being happy and scoring good marks. When the therapist asks the patient to place as many people as possible, the previously assumed correlation becomes less clear than she originally thought. The patient begins to realize that happiness must be based on other factors than scoring good marks. The next technique is pie chart. This technique is used when the patient overestimates her own part or her fault in any situation. The therapist asks the patient to enlist different situations and what aspects could have been faulty in these situations. The therapist then asks her to give the person or the aspect the blame in the certain situation. For example, Nora failed in an exam and she blamed herself for it. But after she made this pie chart, she could see that she is not at the fault completely. Other aspects such as being ill and having a fight with her mother also contributed to this situation. Another technique is historical testing. As the name suggests, historical in this method, The therapist looks at the patient's schemas that were developed during the early childhood. If those schemas are distorted, then her self image remains distorted during the whole childhood. Therefore, this technique focuses on mending her distorted schemas. The patient first collects information about normal child development for each developmental phase. Then, different materials such as photographs, tapes or videos, school reports, and letters are analyzed to either support or refute the argument that the patient has always had a bad experiences when she was a child. It is generally found that the other individuals in the patient's environment knew that there was something wrong in the family, but they never intervened. This is very helpful in creating a more positive self image for the patient. She can more clearly see the role that her parents and the childhood traumas played in the development of her problems. It becomes easier for her to send away the punishing mode as well as to offer more support to the abandoned child mode. The next technique, and a very important one, is flashcards. It is a technique which is useful for the patient whenever she is caught in situations where her punitive mode comes back into play. The flashcard has two sides, one of which has the view of the punitive mode and the another has a view of more balanced and healthy adult. This acts as a reminder for the patient that the punitive side is exaggerating and she does not need to feel that way. The last technique is positive logbook. BPD patients have a tendency to relapse into their old and dysfunctional schemas. Therefore, the patients use logbooks to keep a track of experiences that oppose their old schemas and support the new ones. In the beginning, it is difficult for the patients to think of positive things. They forget to include small daily situations, such as cooking a nice meal or spending an hour at the gym, despite the fact that these contribute to a positive self image. They have a perception that they can only write achievements like getting a new job. Apart from this, patients do not tend to include situations in which their response was good. However, the result was not what they wished. For example, the patient may have told her mother in a very appropriate manner that she did not like, that she did not listen to her when she came back from the office. Even though her mother reacted in a rude manner and the patient became upset about it, it must be mentioned in the logbook because the patient did something which she normally wouldn't have. So it helps the patient to keep a track of the big or small achievements. Also, the therapist must keep asking her about the logbook in each session because otherwise the patient stops writing her logbook. These were the cognitive techniques that can be used for BPD patients. Combining experiential techniques along with the cognitive techniques proves to be very useful.